Whenever I start working with people, one movement that we commonly cover, especially if they're coming in for something related to their pelvic floor, their hip, their back, is the squat. And what we often cover is not only technique, but how to control the squat from standing up, descending down, and then standing back up, using your glutes so that there's not too much tugging on the spine. My name is Dr. Jocelyn Conley. I'm a pelvic floor physical therapist, and in this video, I'm gonna go over one drill to learn how to use your glutes to control hip flexion as you descend into a 2-point squat, which is in standing, or a 4-point squat, which is on the floor. So all you'll need to practice is just the mat and space on the floor, maybe a mirror if you cannot feel this. A 4-point squat is pretty much where you have your toes connected with the floor, because in a regular squat, your feet are connected with the floor, but your hands are also connected to the ground. And this is a quadruped position or 4-point position. And the movement is where you sit your hips back to the point where you begin to round, or where you run out of hip motion and then you come back to the starting position. There's many variations, but this specific variation, we're focusing on the glutes. So what I want you to pay attention to is keep finding neutral spine first. So some people need a little bit of deep core engagement, but with deep core engagement, you don't really see definition on the outside of the belly. But other people can just keep it neutral without any abdominal or core control. And what you're gonna do is you're gonna slowly sit your hips back, feeling the stretch in your cheeks and the back of your hips as you get to this point. Once you get to the end of the range of your motion, you're going to connect with your glutes, and I'm going to give you different options to try. You can either squeeze your glutes until you get back to the neutral position. You can almost try to corkscrew your hips, but your knees aren't actually moving to get you back to the neutral position. Or you could almost think spreading the floor apart with your knees until you get back to the neutral position. And all of those options, your hips, you're not moving. It's just the way you're connecting with your muscles or different fibers of the glutes. And all the while, your spine stays in neutral. It shouldn't round, it shouldn't arch, and you shouldn't feel this, like it shouldn't reproduce any pain in your back or your hip or whatever you may be coming in for. Common errors is rounding or arching during the transition, so I really encourage you to move really slowly. And I'm exaggerating it, but I want you to be able to see it. But it's real slow. You get to this point and then you connect back. At first, your contraction's gonna be on the harder side. But as you get connected to the feel of the movement, try to soften it so that it only is as much as you need to complete the motion. If we brace too hard, if we brace our glutes too much, our abdominals are gonna turn on more. It's okay if they turn on, but whenever you can really, if you could see, you don't see much definition happening in my belly whenever I squeeze my glutes. That we don't want to see that, at least for these motions. Now, if I had like 200 pounds that I was lifting, different story. What I typically will program with people that I'm working with is this drill with some glute isometrics and glute bridges, and the whole point is to learn that control, and then also standing squats, so you learn how to control that. And I'll say practice this for 1 minute to 2 minutes, and do 2 to 3 rounds, 1 to 2 rounds, depending on where you are. If you have any questions, please post them below. Otherwise, I'll see you on the next video.